So the brachial plexus. So one thing you need to master is how to rapidly draw the brachial plexus. So what I usually start off with is drawing these two V's, the lines, and drawing the divisions, and drawing the median nerve. Sometimes to make it perfect. Okay. So here you have the roots C5, C6, C7, C8, T1. You have the trunks, you have the divisions, the chords, and the branches, which of course includes these branches here. You have the musculocutaneous nerve, axillary, there's many mnemonics on remembering where each nerve belongs. Radial nerve, median, and ulnar nerve. So the interesting thing here is to remember the nomenclature for the chords. So what are the chords really? So this is something I had to look up on. So here's the axillary nerve. And the nomenclature of the chords are basically in relation to the directionality on the axillary nerve. So here you have the medial side, which is here, medial chord. Lateral chord is above the axillary artery, and the posterior chord behind it. So here would be the posterior chord. So having that down, what we can begin is straight through the questions of what you may be asked about the brachial plexus lesions. So an example would be if you have a question where there's apposite sensation over the shoulder and the lateral posterior arm, what is the most likely compressed structure? So you have to realize that if you lose sensation over the shoulder and the lateral posterior arm, that could be injuries to the axillary and radial nerves. And the question is, which cord would that be located in? So knowing the relation to the axillary artery, which cord? So what you could do is quickly draw the brachial plexus anytime you have these questions. And from there, you get to see which cord. So we know that the axillary nerve is here and the radial nerve is here. So which cord is this region? This is the posterior cord. So that would be the most likely compressed structure, the posterior cord of the brachial plexus. So another question that you may get is basically an image of the brachial plexus that looks like this. No one really draws it like that, but this is an image that you get, most anatomically accurate. So in the question stem, you may have something like this, where you have a fracture to the surgical neck of the humerus. So this should ring a bell, surgical neck of the humerus. So what injury to the nerve would cause a fracture there would be the axillary nerve. So knowing that ahead of time, you would see that injury to which labeled location explains the patient's symptoms on the question stem. So surgical neck, axillary nerve, we need to find the axillary nerve in this image. And a good thing is to remember that C5, C6 is the area where the axillary nerve is. So knowing that the axillary nerve is in the posterior cord, which is right here, it would be this side, not this side, because this nerve is closer to the C8T1, which is the radial nerve. And this one, it would be the axillary nerve, so the answer would be A. And what about the other nerves here? You have the suprascapular nerve for E, and you have median nerve and ulnar nerve here, just for completeness. Another example is if a patient presents with clumpy palsy. The question stem typically does not tell you the patient has clumpy palsy. They'll probably explain the typical symptoms and presentations of clumpy palsy. So which parts of the brachial plexus is injured? So you want to quickly draw the brachial plexus to confirm kind of where the ulnar nerve is, and basically if you know that it is in the lower trunk right here. So if you label the trunk here, it goes in order upper, middle, and lower trunk. So if we're to ask about which trunk would likely be injured in clumpy palsy, it would be the lower trunk, because this is also where the ulnar nerve is located as well. So these are just basic tips. There's many more questions. If you keep practicing the questions, you'll know exactly what you need to know from the brachial plexus.